Welcome back. Time now 7:20. This past week alone, we've seen some of the highest daily COVID-19 case counts for Hawaii that we've had this entire pandemic amid this Omicron surge. Some visitors even testing positive while in our island. So in some ways, 2022 feeling like a repeat of last year. And Dr. Larry Brilliant is a global epidemiologist who worked with the World Health Organization to eradicate smallpox back in the 70s. More recently, a longtime friend of Hawaii, as you can tell by his shirt today, helping with COVID testing on the Big Island. And Dr. Brilliant joining us live this morning. Happy New Year, and thanks for being here.
Happy New Year, Tom. Thank you for having me.
Absolutely. Well, as we just said, we'll jump right in. You know, we were making progress for a while, then this Omicron variant hit, especially here in Hawaii. This past couple of weeks has been really difficult. A lot of people just really frustrated by this. How can we get this surge under control?
Tom, I think the reason that we made so much good progress in Hawaii is because we had the Aloha Hawaii program, and the Safe Hawaii program. And what they had in common was testing before people get on an airplane and testing particularly on arrival. That's what kept the island safe and kept the case count down. Omicron's not like anything we've ever seen before. It's the most transmissible of all the variants, might be the most transmissible of all viruses. And Hawaii has a unique advantage. It's the only state in the United States that can easily require on-arrival testing. California can't test everybody coming from Nevada. Nevada can't test everybody coming from Chicago. But Hawaii can, the islands can. And to not use that tool, I think, is making a terrific mistake. And I must tell you, I'm perplexed at why that is not used even now.
Well, you know, when the vaccines first came out, we thought that might be a better tool in that situation. Just last week, you know, we asked the state officials, are there going to be any changes to the Safe Travels program? They're saying, for now, other than changing the definition of fully vaccinated to getting a booster shot, there probably won't be any changes to the Safe Travels program. But you're saying test everybody regardless of vaccine status, correct?
On arrival. That's right. I mean, even if you have 85% vaccine on the island, you are receiving visitors from the 50 states. So you're importing the risk from each state. And of course, what really matters is importing the risk from the state that is on fire at that time. And even if everybody ultimately is going to get Omicron, you can choose the time at which it arrives on the island by not letting the virus on the island and slowing down the transmission. That's what's going to save the hospitals. Listen, Omicron is a risk to pregnant women in a difficult pregnancy, to people having a heart attack or having to get chemotherapy for cancer. They can't get into hospitals when your ICUs are overrun. And I think it's a matter of urgency that testing on arrival be resumed.
And you mentioned kind of the unique position that we're in Hawaii. I mean, we've looked at these other island nations, New Zealand, for example, that have been a success story. Obviously, it's a little bit different situation because we do allow travel from other places. But what do you kind of view as the solution here moving forward, other than just testing on arrival? Is there anything else Hawaii can do, especially with our limited resources?
Sure, but I would say the other islands have been a success, and they're nation states. Hawaii is uniquely a state of the United States and has that advantage of being islands. No, there's many other things you could do, but the most important thing is to keep the virus from coming on the island at a time of the virus's choosing instead of the time at your choosing. You don't want more cases coming in, more infection coming in when your ICUs and your hospitals can't handle them. But of course, in addition, I like the idea of redefining fully vaccinated to include booster. I like the wonderful work that's being done on the vaccination drives. I would increase that, of course. I'd also try to find cases that are on the island already by doing random testing. And I'd love to see those sequenced more to find out which ones are Omicron, because you have two epidemics at one time. You've got the Delta surge and you've got Omicron.
And as you know from covering these cases around the world, there's the public health side and there's the government side, and having to make those public policy decisions. Because we mentioned, even if we wanted to test everybody, the lieutenant governor here told us that that may not be legally a possibility unless policies change at the national level in terms of changing our safe travels program for visitors coming into the U.S. Is there anything at the national level that you think can be done or should be done?
Well, you're in the middle of a pandemic. It's an emergency. The state has the obligation to keep its citizens safe. And of course, you've been able in the past to kind of turn on and turn off the spigot of tourists. And I think one of the misunderstandings, even at the government level, is that the hotels would prefer that you test people on arrival. They're not afraid of losing tourists. The worst thing that could happen is to have the reputation of being an island that's got an epidemic. You've got the opportunity to be the safest place in the world, and that will be the best thing you can do for tourism. And I've spoken to a dozen of the hotels, particularly on Maui and the Big Island, but that's certainly the way they feel.
And in the big picture, I just want to kind of ask you, heading into 2022 overall, I mean, it's just frustrating kind of feeling that we're back at square one. There's talk of, well, if enough people get Omicron, could we be heading towards the endemic phase? Just from your experience, where do you see things shifting? Is that the case, or are we in for maybe a longer ride than we thought?
It seems like we're always at a crossroads with this pandemic. I see two very different paths, and one indeed is that Omicron proves to be less deadly. It proves to be less virulent. People who get it don't have to go to the hospital. They have a more mild disease. I hope to God that is true. We have a very different demographic than South Africa had, but it looks like that was true for our data in Germany. So if it is less dangerous, if it continues to be mild, and it is this infectious, it may indeed infect 5-6 billion people around the world, and that would be like vaccinating everybody with one dose. But they still would not necessarily be immune to the next variant. So that's the second possibility, that Omicron does not produce immunity to Pi, Rho, Sigma, Tau, Upsilon, the subsequent letters of the Greek alphabet. And then we're all over it again, but we've suffered from Omicron. I think there's two distinctly different paths. One of a mild disease that acts in almost like a way of being a vaccine, and the other a less virulent disease, but doesn't give you the protection, allowing for subsequent variants to overinfect. And that could be very dangerous because the next variant, by definition, is going to have to be more transmissible than this one. Hard to imagine. Here's hoping it's going to be better. Dr. Larry Brilliant, we appreciate your insight and all that you're doing to help with us here in Hawaii. Hope to see you back here soon. I know you're already ready to go. I'm on my way. All right. Aloha. All right, aloha. Take care. And we'll have that full link to that interview on KITV.com after the show. Meanwhile, we're off for a break. You're watching Good Morning Hawaii. We'll be right back on your Sunday morning.